Hi, I'm Dr. Michael Carey with the VEBA Resource Center. Today I'm going to be talking about this wonderful tool. It's called the foam roller. As a chiropractor, my patients use this all the time, and it really helps with their posture, their muscles, their fascia, everything. What I'd like to do is really talk about the basics today. If you're new to foam rolling, you want to get one like this that's at least this size. It's 3 feet long and it's about 6 inches in diameter. The softer, the better when you initially start. Let's get started. Let me show you the mid and upper back demonstration. You start like this. You sit in this position, put the foam roller right up against you like this, and sometimes it may slide out, but you want to hold it, lean into it just a little bit. Now I'm scooting with my butt down this way. And if you find a sore spot, just stay on that for a little bit, breathe into it, and then you can move in this direction. When you start, you can scoot and move all the way up to your shoulders, and then back down to that starting position. The next step is put your hand behind your head to support your head and neck. You can lift your butt and you can start to do more of a rolling. So the rolling is super helpful, and it helps, like I said, with your posture. It helps with the muscles and the fascia. And when you find that spot that's a little sore, stay on it. You can breathe into it. It's easier to move through it initially. You can rest, put your butt down. You can work each segment of your spine by flexing your head and bringing it back down. And then I can go up like this and go back down. And then work it and back down. I just showed you the basics, but something to keep in mind is I want you to stay away from putting pressure on your low back, specifically pressure up into it. This is the wrong position because it's putting pressure on your lower back. This, in the beginning of your mid to upper back, is the right position where you start. You start right here. You don't start right here. Start here. So see, your butt's going to be on the ground and you're going to be a couple inches away from your body. Again, this is what you don't want to do. You don't want to start like this because you're pushing pressure up on the lower back. What you want to do is start with your butt on the floor, hold the foam roller close to your body. That's your starting position. Here's the second demonstration. This one's a little bit trickier. It's going to require a little bit of balance. I've done this for years, so I make it look easy. And we're going to go from our tailbone all the way up to our head. And I'm going to sit on it this way. So it's going to go just like this. Let me sit on it for you. Palms are up facing the ceiling. They're not facing down. This helps with your posture and your upper back. What you're going to do is you're going to take a breath in. You're going to exhale, and I'm going to do a little shimmy with my feet. So I'm only going over like 1 to 2 inches off my spine. Then I inhale. And I exhale and I go all the way to the other side. And you can do this back and forth 3 to 5 times just to open this up. And if you just want to sit here for a little bit, that will help open up your chest and help your posture. The other thing that you can do to help your movement with your shoulders when it's connected to your spine is slowly move your hand up along the floor. And what I do with my hand to really get the best benefit is I spread my fingers, and I want the back of my wrist to be on the floor as much as possible. So if you're ever a child in the snow, you've made snow angels, this is what you can do. And you just go slowly. You're not trying to, if it's uncomfortable, just go to where you can tolerate it and then come back down. If you're new, you may experience some soreness. The way to lessen the soreness is to lessen the body weight that you put on this. So use your feet and your lower body and your arms to lessen the soreness. Eventually, you may really like it a lot like I do. And I love this thing. This is the little shorter one. I travel with it. It fits in a carry-on. You can put your socks and underwear. It doesn't take up lots of space, but you'll love it, especially after a long trip. I'm Dr. Michael Carey, and we'll see you soon.